Good evening. Tonight we're going to go live on Instagram as well as on YouTube. So we're going to try something out because I've recently been trying to do some things on my YouTube channel where I've taken prior videos that were uploaded from Instagram, run them through some AI filters, which has transcribed them, and then also done a summary of them. So if you go to my YouTube channel, which is just at Dr. Twyman, for the month of January of this year, all my videos that I've done these Ask Me Anythings will be there. And again, there'll be summaries and a full-on transcript. But I'm also going to try to do IG Live plus live on YouTube. So we'll test it and see, is there better sound quality? Because I know I'm still getting some concerns that people can't hear it as well. I think it's mostly when I take the videos down from Instagram and upload them to YouTube that there's a loss of fidelity. So we'll just record them live to both of them at the same time and see which one sounds better for you. So we'll hit some questions tonight, starting now. So first question up tonight, what are my thoughts on red yeast rice instead of prescription statins? So red yeast rice is a supplement. It has the same effect on the enzyme, HMG-CoA reductase, as the statins do. It is not a statin per se, but it is marketed as a statin in some other countries. But there's some other factors that it does other than statins. So, some patients, I would say if you're hesitant to take a statin, then red yeast rice wouldn't be for you. But if it's something that you want to try before going on statin, some patients it works for. But generally got to go up to 2,400 milligrams a day of it, and you need to get a high quality brand because there were some problems some years ago with some fillers in it that was causing some kidney problems. So if you have a good brand and you monitor your lipoproteins and ApoB levels, then you can see if it works for you. But another one that I often use that works in the same production blocking mechanisms as statins and red yeast rice is bergamot. Question up tonight about how can somebody protect their thyroid while in the workplace. I anticipate this question is based off of something related to artificial light or blue light irradiating your thyroid, with time in front of a computer, laptop, iPad, or such. You could I can't mess it up right now, but we're wearing a quarter zip, so you can zip it up and cover your neck. If you're so inclined, you can wear an old school ascot if you're a guy. Otherwise, wear a scarf as a woman. But there is a company, Get Lambs, that does have a radiation shield. I believe it's about $90, and it is meant to block different wavelengths of light from hitting your thyroid. So if you want a purpose-made thing, Get Lambs has one. Question up about, do nitric oxide levels decline on a carnivore diet? No, not necessarily, but on a carnivore diet, you're not going to be eating a bunch of green leafy vegetables, so you're not going to be consuming a lot of nitrates in your diet for the most part. If your arteries are healthy and you exercise, you can produce nitric oxide through the way that is induced by blood going across the endothelial glycocalyx and causing the underlying endothelium to release nitric oxide. So it doesn't automatically lower nitric oxide levels, but there's a potential. So you can always test. There's salivary nitric oxide test strips from a couple different companies. I tend to like the MyFit strip ones. You can monitor blood pressure. Is it less than 120/80? And then there's devices, if you have access to them, that look at pulse wave velocity and endothelial function. That will tell you if you have optimal nitric oxide levels on a carnivore diet. Question about testosterone replacement therapy and lipid issues. Person reports a high LDL, low triglycerides, high HDL, glucose around 95. So it is possible sometimes that the HDL will be affected by testosterone replacement. It's, again, one of those test don't guess type of situations, is you want to know what your levels were pre-testosterone therapy and then look afterwards. And it depends on why you're on testosterone replacement therapy. If the symptoms are improved, low libido, brain fog, muscle mass is a problem before you're on testosterone, well, then just deal with the lipids afterwards. If you need to consider statin therapy or supplements or PCSK9 inhibitor or ezetimibe, then do what you need to do if testosterone's working for you. question tonight about, is berberine an effective option to treat cholesterol in patients with high ApoB? Is it effective as monotherapy? No, just flat out it's not. Yeah, but is it often good adjunctive therapy? Absolutely. So berberine is a supplement. It's multiple use cases, but from a vascular standpoint, it does a few important things. It does affect the LDL receptors by promoting their ability to stay out longer to grab the ApoB particles as they're floating by. It does that by blocking the PCSK9 enzyme. So not nearly as potent as Repatha, Praluent, or idlasclerin, but it may help a little bit. It works similar to metformin at decreasing glucose released from the liver, so helps with patients who have insulin resistance, prediabetes. There is some ability for it to be helpful as an antioxidant, so it may prevent some oxidative stress, damage to the glycocalyx. So it is a versatile supplement. But is it effective at lowering super high ApoBs by itself? No, not generally. So it's good add-on therapy to things like Reddy's rice, bergamot, or prescription medicine. So often get away with using lower dose statins plus berberine. Question about, is there any danger to a 55-year-old healthy trained female doing HIIT intervals above max heart rate 175 beats per minute? It really depends. So depends on if you have an abnormal CT coronary calcium score. Do you have an abnormal CT angiogram? Do you have microvascular disease on the stress test or have EKG changes? Unknown. But at the higher heart rates, there's always more risk that you can rupture a plaque. So it's not a risk-free situation to get that high. And it depends on why you're getting your heart rate that high. If it's just for general well-being and longevity, there's really probably no reason to push your heart rate that fast. Now, if you're a professional athlete and you haven't been trained to get that high, that's another story. But is there danger? Yes. Is it high danger? Probably not. But you probably would need more testing or an exam with somebody who could say, yes, you're truly low risk. Somebody just giving me some feedback. So thank you for taking questions weekly. Hal, you're very welcome. I very much appreciate you guys' time and attention and asking good questions so that we all can learn from each other. Answering these questions helps me be able to answer questions from the patients that sit down in front of me at Apollo Cardiology and ask my interpretation of their risk of having a heart attack or stroke. So always love teaching myself things and then teaching you guys what I learned as well. So thank you for the kind words. And I think there's only two more pre-submitted questions that we're going to answer, and then I'll go into any ones I've put into the comments. So could yellowing of the teeth possibly have something to do with plaque and calcification? Probably not the yellowing per se, but if you have a lot of hard calcified plaques on the teeth, that is often an issue with calcium metabolism. You may be low on vitamin K2. Sometimes that helps, but oral health is very much connected to vascular health. If you have oral inflammation, that can have an effect on arterial health. So it isn't by itself a standalone risk factor, but you may want to be doing other testing that looks at endothelial health, oxidative stress, inflammation, lipoproteins, and you'll know, is there a connection in your case? And then the person loves that I had a beautiful background, art with the sun on my Ask Me Anything. So I've been playing around with DALL-E with ChatGPT 4. It's fascinating. I don't believe AI is going to be taking at least my job anytime soon, but I got some things I'll be sharing with you guys in just a moment. But DALL-E is pretty fascinating. I just went in there and typed up, said, please draw me a cool picture of Apollo, the sun god, with a picture of a sun on the image, as well as the background colors being red and purple, which are the colors of infrared light and UV light. And that's what it pops out within 10 seconds of putting in that prompt. So it looks pretty cool. So I'm going to keep using those as my backgrounds on these AMAs. But for those that are joining now, I'm saying I'm doing a little bit of experiment tonight. I'm running this live on Instagram as well as on YouTube. I do have a YouTube channel for those that aren't following me there yet. It's just YouTube/@ Dr. Twyman. I've previously been taking these AMAs, so people aren't following me on Instagram and uploading them to YouTube. But I think there's always a loss of fidelity in some of the audio quality when I do that. So I'm going to try to play around a little bit with directly recording to YouTube at times. But on that channel, I was saying that I took all my images and videos from January of this year, ran them through some AI filters that transcribed them. So there's a full transcription as well as a summary of what questions were asked and what my basic answers were. So just trying to have technology make it a little bit easier for people to find this type of content. But I think there's a way, and I'm gonna play around with it. No promises that's gonna work well, but if you have access to ChatGPT Plus, they've rolled out some GPTs where you can create your own varieties, and I may be able to take some of my transcripts, my previous podcasts, plug them in this, make a Dr. Twyman GPT, and essentially it could be like a repository for these AMAs. You could then query this GPT and be like, Dr. Twyman, what do you think about blue blockers? And it would give you an answer in my wording, the way I've said before, on one of my 4 years archives of AMAs. I'm only going to do a couple weeks at a time to slowly add over it as we go. But AI is super fascinating. So if you're not well aware of it, that's fine. It's coming. But those pictures that I'm putting on Instagram, those are mostly coming from DALL-E right now. And I think another question popped up in the pre-populated ones, and I'll hit the ones in the comments in a moment. So why does 1.6 calcium score would build up in the left main, put them in the 35th percentile for their age at 59 and gender, female? What testing should I do next? I mean, generally in all comers, if your calcium score is over 0, that's 60% of the time that's going to happen after the age of 40. The percentile, that seems probably high for me, but for a calcium score of 1.6, but it is possible. I have definitely seen patients in their 80s still with scores of 0, but I've also seen guys under 40 with scores of nearly 1,400. So I'll give you some perspective. Your score is abnormal, but not high risk. But once you have any evidence of calcification in the arteries, you got to go look at why is that happening. It started that you had endothelial dysfunction, you had vascular inflammation, and lipoproteins got retained in there, plaque built up. So blood testing would work, and then doing testing that looks at endothelial health. Nitric oxide testing and potentially carotid intermedial thickness testing can tell you, is this a problem that you took care of years ago, or is this still an ongoing vascular inflammatory problem? So if you're interested in potentially working with us at Apollo Cardiology, you can go to my website, drtwyman.com, and there's an application there, or talk to your local doctors about doing some vascular testing, as well as advanced blood work that looks at nitric oxide availability, inflammation, oxidative stress, and your lipoproteins, particularly ApoB, and I would get LPA checked at least once if you've not had it previously checked. All right, now I'll hit the questions in the comments here. So somebody's asking, is there research to support arteriosil and how? Yes, there's definitely support articles on their website. Full disclosure, I've been a previous speaker for Calware, the company that makes arteriosil. If you go to the website, there is some research articles for people who are so inclined to look through them, but it depends on what you're interested in. There are studies that look at it improving arterial elasticity. So I have a device in my office called the Max Pulse that was used in a previous trial by a doctor in Texas to show that people's arteries got more elastic after one dose of arteriosil by up to 80%. There's studies that were using MRIs of the carotid arteries that was looking at soft plaque, and the soft plaques are regressing nearly 40% in under 4 months using this product. There's some studies that are done more in animals, and then they have a microchip that has cultured endothelial cells. I tend to like the ones that are done in actual humans more than that, but there's a lot of articles that if you go looking for it, you're going to find good data on. Somebody's saying, can bergamot help with high absorbers? No, not really. Really only a hyper producer would bergamot work for. Other than ezetimibe, there's not a lot of things that can be done for high absorbers from a prescription standpoint. Dietary wise, you could cut out saturated fat to see if that has an effect, or cut saturated fat down to 8% of your calories. If you have a CT coronary calcium score of 90, what are the chances that the plaque in the other arteries? Also, if you repeat the calcium scan 4 years or 5 years later, will plaque be lots higher? So to the first part, It always depends on what age you are when this calcium score is 90. If you live long enough, you often will pop positive, like I was saying before, but I have seen people in the 80s with scores of 0. Um, but that just tells you that you have hard plaque in the artery that they'd seen it. There's still chances you're going to have soft plaque in the other arteries. And so that's why a CT coronary angiogram, particularly if you do a CT coronary angiogram that uses the Clearly analysis, you will also be able to know what kind of soft plaque you have in the arterial walls. Second part of your question, once your score is above 0, it's rarely, in my opinion, that useful to repeat a calcium score. You're already considered higher risk than somebody who has a score of 0, so just start treating the risk factors that you find. If you do nothing, often your calcium score test will increase 20% every single year. So if you repeated your scan 5 years later, your score may be 200 by that point. What would you do differently? So I wouldn't wait. I would start treating right now. And then often, if you use certain medications, particularly statins, calcium score test often goes way up. Often you're just taking the soft plaque that's more prone to rupture and calcifying it or delipidating the plaque. The calcium is usually a stabilizing factor. So that's why I don't usually repeat calcium scores once they're above 0. So somebody's saying that their 90-year-old mother previously was admitted for heart failure, atrial fibrillation, their ejection fraction dropped from normal to 40%, which is mildly abnormal. And then her father passed away last year. And I don't know if you're asking if the mother or the father potentially had broken heart syndrome, because the person had a cath with non-obstructive disease. So broken heart syndrome, also known as Takotsubo syndrome, which is a stress-induced cardiomyopathy, is possible. It's microvascular disease. It's endothelial dysfunction. That is what's causing that. High catecholamines, causes this vasoconstriction. It's a classic picture on angiogram where the base of the heart squeezes very well, but the apex of the heart, doesn't move at all, and it looks like a pot that they use to try to catch octopus in Japan. Thus, a Takotsubo vessel. So it is possible, but without more data, I wouldn't know for sure. Somebody's asking, are there any concerns of doing a VO2 max test if they've had a heart stent? If the heart stent is not recent, like if the heart stent is over a year ago, then probably not a big issue, but you'd have to ask your treating cardiologist, if they think that's a good test for you to do at that time. All right, probably not going to go deep into this tonight because it would take a lot more time than we have on this kind of a quick Q&A type of a panel. But my opinion on the Oreo cookie study, I think it's stupid social media tricks, honestly. You can modulate your lipids doing some significant dietary interventions, but what is actually going on with your endothelium, what's going on with inflammation, that's much more important to focus on. I think it's stupid party tricks, honestly. And it's really the time under tension. How long is your ApoB high? Just because you can drop your lipids, with an Oreo diet for a week, did that lower your risk? Probably not. So I'd want to know how, the person's nitric oxide availability is, their endothelial function, the pulse wave velocity, soft plaque, hard plaque. We want to know what all those metrics we're actually doing. Question, what is the best statin for lowering lipoprotein A? So lipoprotein A is the number one inherited lipoprotein that increases early cardiovascular disease. But it is not lowered by any statin today. There are no effective treatments that significantly lower lipoprotein A. Niacin, which is a supplement, may affect it a little bit, 15%, maybe 20%. The drugs that do have an effect are the PCSK9 inhibitors, such as Repatha, Praluent, Ilascleran. They may lower it 30%, but is that clinically significant? Still not known. Often, though, if you use a statin, lipoprotein A goes up. That doesn't mean you're necessarily getting worse because you're significantly lowering the ApoB that's on your LDL particles. think of it as seesaw. The LPA goes up a little bit, but the other particles go down in more proportion. So somebody said, what supplements do I like in place of statins? Talked a little bit about bergamot, berberine, but it always depends on what's going on with the arteries. If you have significant plaque in your arteries, supplements aren't always the first line. You should really consider pharmaceutical agents to put out the fires if you need to. Somebody's asking, why does the heart beat so fast and hard when they bend over and stand up? Unknown, are you hypotensive? Are you having premature ventricular contractions? Are you dehydrated? Do you have electrolyte imbalances? Would not know for sure without a physical exam and more history. Is Takotsubo a not real heart attack? I don't want to call it that per se. Takotsubo, or stress-induced cardiomyopathy, presents looking like a heart attack. You have classical pain, pressure, tightness in your chest. You have ST elevation, EKG changes. So it sure looks like a heart attack. And you get rushed off the cath lab. So I treated, I don't know how many, I don't even know, less than 100, but more than one cases of Takotsubo in my career. And you take them to cath lab to find out. And then when you do the angiogram, they don't have significant plaques in arteries. They haven't ruptured a plaque. And when you put a pigtail catheter in the left ventricle, you get that picture that the base is pounding away, but the apex is akinetic. You're like, oh, this looks like a Takotsubo type of pattern. And then, the goal is blood pressure support, stress management, and then, the cardiomyopathy tends to improve. But you have to figure out what drove it. And often that is the situation, is that, somebody had some really bad news, a loved one died, somebody was in a car accident, boom, this fires off. So it is something that's possible. And my kind of opinion at this time, it is just a issue with microvascular disease, and it's acute endothelial dysfunction, essentially. All right. And then I actually did get a live question on YouTube on the other screen I got over here. So welcome. So what is the best way to increase nitric oxide naturally? UVA sunlight. So sunlight strikes your skin, the blood vessels come to the surface, dilate because nitric oxide is getting released. Exercise, as blood is pushed across the endothelial glycocalyx, it transduces the signal to the underlying endothelium. Nitric oxide gets released. And then nitrates, mostly green leafy vegetables and beets. Those are the best ways to naturally improve nitric oxide levels. And somebody's asking me, I think, any experience in treating, I think it's left ventricular non-compaction. No, not really. I mean, I saw a couple cases when I was in my cardiovascular fellowship, but that's not my area of focus at this time. And I think I'll answer one more question tonight, or two maybe. Do I believe saunas help the heart? Absolutely. I have a sauna in my house, a sauna at my previous place. Love to do them, especially in the wintertime. The infrared heat is very relaxing, helps your body get rid of different toxins, particularly heavy metals, activates heat shock proteins. It structures the water in your blood vessels. That's how it actually probably helps the heart most. It just helps the blood flow better. And Finland, they use it routinely. That's where I was last February. I think that's the only way they survive the winter without having sunlight for 6 weeks is they use their sauna therapy to kind of charge up the water batteries in their system. So big fan of sauna therapy if you have access to it. All right. The question, why are blood pressures so stochastic? Person's checking their blood pressure more frequently than usual. Blood pressures can read wildly different independent of stress. Stress is one thing that drives it, but it also depends on time of day, depends on different hormones throughout the day, depends on salt intake in some individuals, caffeine intake. So there's going to be a fluctuation throughout the day. That's why, if you truly have issues with blood pressure, the best diagnostic way is to have a 24-hour ambulatory blood pressure monitor to get your average blood pressure and see when you're having these spikes. because if you're on supplements or on medications, then that helps you understand what time of day you should be taking those supplements and medications so that you have more even blood pressure throughout the day. And then somebody's asking, is valve regurgitation considered heart disease? Yes, it's valvular heart disease. And can they cause a heart murmur? It's actually the other way around. So heart murmur is just turbulent flow across either a valve or part of the cardiac structure. So you can have valvular regurgitation, valvular stenosis. Regurgitation is the valve is leaking. Stenosis is the valve is tight. Somebody's saying their sauna can make their heart race. So this is not medical advice. You have to kind of be cleared by your doctor to say you're healthy enough for sauna use. But if you're doing saunas, you have to hydrate well, make sure your electrolytes are doing okay. And if you're on blood pressure medicines, got to be careful with that. Make sure you're not on diuretics that would get you too dehydrated. What kind of sauna do I use? I currently have a relax sauna. It's like a one-person pop-up sauna. I previously had a impulse 3-person. I can't remember. I think I had a sauna space, and that's one I really enjoyed. But ended up moving, and I gave that one away. But they're mostly I have infrared ones. But if you have access to a finished sauna, those are outstanding as well. All right. And does high temperatures increase premature ventricular contractions? I don't know if that's in relationship to sauna use, but potentially it would. Okay, so we're about at the bottom of the hour. So I was saying earlier, if you don't follow me on Instagram, I should say you're already following me on Instagram on this page. I'm not sure the people on this side is following me on Instagram. These people are actually live on my first time doing it on YouTube. So I do have a YouTube channel for those that aren't following me there. It's youtube.com/Dr. Twyman. I put any of these archived videos up there on my YouTube. I have some longer form videos on YouTube, and that's where I'm going to start putting more and more content there. Because I think ultimately, I get some feedback that Instagram doesn't have good audio. I can't control if they have good audio. I'm using a very fancy Rode microphone and trying to speak as loud as I can into this thing. So if their audio isn't good here, then I have much fancier microphones at work that I can then push into YouTube. So if they start having issues here, you're going to see more stuff getting shifted over to YouTube. So, but thank you guys for your time and attention tonight. Next week, I'm actually going to take off. I'm going to be out in the area. Let's just say it that way. You'll find out later the next time I come back. And then we'll go back doing some of these IG Lives the way we're doing. I do have some ideas of having kind of a school where a lot more of my content will kind of live, and then we can kind of start going over like other topics you guys want me to be chatting about, and then I'll start making some more long form content for those things. So I appreciate you guys. Have a great week. Send me some comments if you like the way that we're going through here, and if you don't follow me on YouTube, please try to follow me on YouTube. So see you guys next time.